Welcome to our video on 8 common drugs that can cause dementia. It's a harsh reality that many of us may face as we age, the fear of losing our memories, our minds slipping away. But what if I told you that there could be a hidden culprit, something we might not expect? Medications, substances we trust to alleviate our ailments and improve our quality of life can have unintended consequences on cognitive health, especially when used over prolonged periods or in higher dosages. Recent research suggests that certain medications could be linked to dementia, a progressive brain disorder that impairs memory and cognitive abilities. In this video, we're going to explore the medications that have been linked to an increased risk of dementia. The list of drugs contributing to this silent epidemic is extensive, including common medications used for allergies, overactive bladder, certain antidepressants, and even some sleep aids. So many of us are unknowingly putting our minds at risk. It's important to understand that not everyone who takes these medications will develop dementia, but the risk cannot be ignored. By understanding the potential risks associated with these drugs, we aim to empower viewers with information to engage in informed discussions about their healthcare options with their healthcare provider. There may be alternative treatments available with fewer risks. In this video, we will be discussing some natural treatment options to each medication, so stay tuned until the end. A quick reminder, this video is for educational purposes only. If you or your loved ones are currently taking any of the medications we'll be discussing, it's essential not to make any changes to your regimen without consulting a healthcare professional. Let's get started. One category of drugs that has been associated with dementia is anticholinergic drugs. Anticholinergic drugs are a class of medications that block the action of acetylcholine, a neurotransmitter involved in various nervous system functions, including memory and learning. In the brain, blocking acetylcholine can lead to various effects such as sedation, drowsiness, and in some cases, relief from certain types of mental disorders. However, it can also cause short-term memory loss, confusion, and cognitive impairment, especially in the elderly. In other parts of the body, anticholinergic drugs can relax smooth muscle, which is found in the walls of internal organs. This relaxation effect can be useful in treating conditions like gastrointestinal cramps and urinary incontinence. Research has increasingly indicated a potential link between the prolonged use of anticholinergic drugs and an elevated risk of developing dementia. This association is particularly concerning because these drugs are widely prescribed, especially among older adults who are already at a higher risk for dementia. The primary concern lies in the mechanism of action of these drugs. By inhibiting acetylcholine, which is crucial for cognitive processes like memory and learning, anticholinergic drugs can have short-term effects like confusion and reduce mental clarity. When used over a long period, these effects may contribute to or accelerate the decline in cognitive functions, potentially leading to dementia. Several studies have shed light on this association. For example, a notable study published in JAMA Internal Medicine found that participants who used strong anticholinergic drugs daily for 3 years or more had a 54% higher risk for developing dementia compared to those who took the same dose for 3 months or less. Results also suggested that the risk for dementia with anticholinergics remain even after drug discontinuation. Some anticholinergic drugs linked to dementia risk include: Number 1. Allergy and cold medications. These include the popular drug Benadryl with the generic name of diphenhydramine. Other drugs with diphenhydramine are those with PM like Tylenol PM, Advil PM, and Aleve PM. Other drugs in this category include carbinoxamine, chlorpheniramine, clemastine, hydroxyzine, promethazine, and cyproheptadine. Some natural ways to manage allergy and cold symptoms are: 1. Nasal irrigation. Using a saline solution with a neti pot or nasal spray can help clear nasal passages, relieve nasal congestion, and remove allergens and irritants. 2. Honey. Consuming local raw honey before allergy season is in full swing is believed to help with allergies, as it contains trace amounts of local pollen, which might help your immune system adapt to these allergens. 3. Quercetin. A natural plant pigment found in foods like onions, apples, and berries, quercetin is said to have antihistamine properties that can help reduce allergy symptoms. 4. Probiotics. These beneficial bacteria found in foods like yogurt and kefir or in supplement form can support the immune system and potentially improve allergy symptoms. 5. Steam inhalation. Inhaling steam can help ease congestion and sinus discomfort. Adding eucalyptus oil or menthol to the water can enhance this effect. 6. Acupuncture. Some people find relief from allergy symptoms through acupuncture, a traditional Chinese medicine technique. If you have ragweed allergy, avoid bananas, melons, cucumbers, zucchinis, and sunflower seeds, as they can trigger an allergic response in your system. Our next anticholinergic drugs linked to dementia are medications for overactive bladder or OAB. These include oxybutynin, ditropan, oxytrol, tolterodine, ditrol, and solifenacin, Vesicare. Here are some natural alternatives for managing overactive bladder. 1. Pelvic floor exercises, Kegels. Strengthening the pelvic floor muscles can help control urination and reduce the urgency and frequency of OAB. Kegel exercises are particularly effective for this. 2. Bladder training. This involves gradually increasing the time between urination to train your bladder to hold urine longer and reduce episodes of urgency. 3. Dietary changes. Avoiding bladder irritants like caffeine, alcohol, spicy foods, and acidic foods like citrus fruits and tomatoes can help reduce OAB symptoms. 4. Mind-body techniques. Stress management and relaxation techniques such as yoga, meditation, and deep breathing exercises can help reduce bladder urgency caused by stress. 5. Biofeedback. This technique uses electronic devices to help you gain awareness and control over pelvic floor muscles. Third on our list are muscle relaxants. These include cyclobenzaprine, Flexeril, and orphanadrine, Norflex. Here are some natural alternatives for managing muscle spasms. 1. Massage. Massaging the affected muscle can help relieve a spasm by increasing blood flow and relaxing the muscle. 2. Magnesium supplementation. Magnesium works as a natural calcium blocker to regulate muscle contractions and help muscles relax. Magnesium deficiency can cause muscles to contract too much. 3. Herbal remedies. Certain herbs like chamomile, which has natural muscle relaxant properties, can be taken as a tea. Other herbs like valerian root and passion flower are also known for their muscle relaxing effects. 4. Essential oils. Some essential oils like peppermint and lavender are believed to help relax muscles when massaged into the skin, diluted in a carrier oil. 5. Regular stretching. Gentle stretching exercises can help alleviate and prevent muscle spasms. Yoga and Pilates are good options for incorporating regular stretching into your routine. Next on our list are medications for gastrointestinal disorders. These include hyoscyamine, levsin, dicyclomine, bentyl, propanthyline, probanthine. Some natural alternatives for managing gastrointestinal disorders include 1. Ginger. Known for its anti-nausea properties, ginger can be consumed in various forms, such as tea, capsules, or fresh, to help with digestive discomfort. 2. Probiotics. These beneficial bacteria found in yogurt, kefir, sauerkraut, and supplements can help balance gut flora, improving digestion and alleviating some GI symptoms. 3. Apple cider vinegar. Some people find relief from digestive issues with apple cider vinegar, which is thought to aid digestion. It should be diluted in water before consumption. 4. Herbal teas. Certain herbal teas, such as peppermint, ginger, and chamomile, are known for their soothing effects on the digestive system. 5. Peppermint oil. Peppermint oil, often taken in capsule form, has been shown to be effective in reducing symptoms of irritable bowel syndrome, IBS. Our next anticholinergic drugs linked to dementia are medications for Parkinson's disease. These include trihexyphenidyl, artane, benstropine, cogentin, amantadine, Simitrel, procyclidine, Kimedrin. Natural alternatives for managing Parkinson's disease symptoms focus on supporting overall health and potentially alleviating some symptoms. Here are some natural strategies. 1. Regular exercise. Exercises like water aerobics and those that focus on balance and flexibility, like yoga and tai chi, can help improve motor function, balance, and overall quality of life. 2. Acupuncture. Some individuals with Parkinson's find relief from certain symptoms like pain and stiffness through acupuncture. 3. Massage. Massage can help alleviate muscle tension and improve relaxation, which might be beneficial for some Parkinson's symptoms. 4. Physical therapy. A specialized program called LSVT Big Program is designed for Parkinson's patients that focuses on making bigger and more controlled movements to counteract the slow, small movements typical in Parkinson's. 5. Speech therapy. For speech difficulties, working with a speech therapist can be beneficial. Some natural exercises and techniques can help improve voice control and swallowing. Number 6 are medications for depression and mental health disorders, tricyclic antidepressants. These include amitriptyline, Elavil, imipramine, tofranil, and doxepin, Sinequan. Some natural alternatives for managing depression and mental health disorders include 1. Regular exercise. Physical activity, particularly aerobic exercises like walking, running, cycling, or swimming, has been shown to have a significant positive effect on mood and can alleviate symptoms of depression. 2. Cognitive behavioral therapy, CBT. Although not a natural remedy in the traditional sense, CBT is a non-pharmacological treatment option that can be highly effective in managing depression and anxiety. It involves working with a therapist to identify and change negative thought patterns and behaviors. 3. Social support. Engaging in social activities, maintaining relationships, and seeking support from friends and family can provide emotional benefits and alleviate feelings of loneliness and isolation. 4. Healthy diet. A diet rich in fruits, vegetables, whole grains, lean protein, and omega-3 fatty acids found in fish, flax seeds, and walnuts can support brain health and improve mood. 5. Herbal supplements. Some herbs, such as St. John's wort, saffron, and SAM-E, have been studied for their potential effects on depression, though it's crucial to discuss with a healthcare provider before starting any supplement, as they can interact with medications. It's important to note, however, that these natural approaches can complement but not always replace traditional medical treatments, especially in moderate to severe cases. Consultation with healthcare professionals is crucial. Next up are medications for motion sickness. These include meclizine, antivert bonine, and scopolamine, transderm scop. Some natural remedies for motion sickness include 1. Ginger. Ginger is one of the most well-known natural remedies for motion sickness. It can be taken in various forms, such as ginger tea, capsules, or fresh ginger root to help alleviate nausea. 2. Acupressure wristbands. These wristbands apply pressure to specific points on the wrist, the P6 or Niquan point, believed to reduce nausea and vomiting. 3. Peppermint. Peppermint, in the form of tea or essential oil, can have a soothing effect on the stomach and help reduce the sensation of nausea. 4. Controlled breathing. Practicing deep, slow breathing can help reduce the feeling of nausea and calm your stomach. 5. Positioning in the vehicle. In a car, sitting in the front seat and looking forward can help. On a boat, staying in the middle where there's less motion, and on a plane, choosing a seat over the wings or toward the front where there's less turbulence can be beneficial. And number 8 are medications for insomnia, doxylamine, Unisum, Vicks, NyQuil. Some natural remedies for insomnia include 1. Relaxation techniques. Mindfulness meditation and deep breathing exercises can reduce stress and induce relaxation. 2. Herbal teas. Chamomile, valerian root, and lavender teas can have a calming effect. 3. Regular exercise. Engaging in regular physical activity, especially in the morning or afternoon, can improve sleep quality. Avoid vigorous exercise close to bedtime. 4. Supplements. Melatonin, a hormone that regulates the sleep-wake cycle, can be taken as a supplement, but consult with your healthcare provider first before starting. 5. Sleep hygiene improvements. Keeping a consistent sleep schedule and comfortable sleep environment can help improve sleep quality. As we wrap up our discussion today on medications that can cause dementia, it's important to remember that medication, while crucial for many health conditions, always comes with its own set of considerations. The link between certain medications and dementia risk, as we've explored, highlights the delicate balance in medical treatments, especially for older adults. Regular review of medication regimens, consideration of alternative therapies, and close monitoring for cognitive changes are key steps in mitigating potential risks. Remember, if you or a loved one are currently taking any of the medications we've discussed, it is advisable not to stop them abruptly but to consult with healthcare professionals. Physicians might consider alternative medications with a lower anticholinergic burden or adjust dosages accordingly to minimize risk. And before you go, don't forget to hit the like button and subscribe to our channel for more content that helps you stay informed about your health and well-being. Stay aware and stay informed. Thank you for watching, and we'll see you in the next video.